Hey everybody, this is Dr. Matt Joosse at Joosse Family Orthodontics in Williamsburg, Virginia. We'd love to create amazing smiles using braces and Invisalign clear aligners. This is an Invisalign clear aligner case, and just a reminder, Invisalign is only a tool, just like a hammer is only a tool, and a hammer can only be used effectively in the right hands. And so likewise, Invisalign is a tool that really requires a lot of knowledge on how to use it effectively. And so this is a case that I think is a really amazing case for a variety of reasons. So let me introduce you to Rob. Rob came to us because he wasn't happy about his bite. And if I zoom in, you can see that none of Rob's front teeth touch. We call this an anterior open bite. And I think one of the contributing factors to Rob's anterior open bite was the use of a mouth guard or night guard that only covers his front teeth and doesn't cover all the back teeth. So if you have a night guard, usually you want it to cover all of your teeth. You don't just want one that covers in the front because it can change your bite. And so he was thinking that his bite had changed over time, but because it happened so gradually, he really couldn't say for sure. Now, I created a video that's a lot like this, and I'll draw some comparisons to that a little bit later, but we do have another video that you can watch about why it's important to have your night guard made from a professional and not just getting one through the mail or at CVS or something like that. But as you can see, anterior open bite. In fact, if I show you Rob's bite from the back, only his back two teeth are touching. Really nothing else touches forward of those back two teeth. And so all the work of chewing is really being done in the back, and really the load for chewing should be shared among all these teeth in the posterior. So we started Invisalign treatment for Rob. Overall, his treatment took 10 months, and here is what his bite looks like. So you can see that the front of the bite is completely closed and looking really good. So he can actually bite into a sandwich and get all the lettuce and tomato. He can bite through the lettuce and tomato. He can also bite into a piece of pizza and get all the cheese and the pepperoni, in his bite as well. So really happy about that. When we look at the posterior bite, everything is touching from the canine teeth all the way back. And so we're really thrilled about that development. And of course, the smile looks a little bit better as well. And he's happy about that. So really an amazing case. Especially considering that we did all this in about 10 months, which is really quite remarkable. So a couple of things to demonstrate. So first of all, what we were able to do made a much more aesthetic smile. If you look over on the left side where we started, and you look at, kind of draw a line from the edges of those front six teeth, it almost forms like a shallow rainbow. And that is the exact opposite curvature of his lower lip. So the curvature of the teeth, if you will, and the curvature of the lower lip are not consonant with one another. Now, if you look at the right side and you kind of draw a line on these front six teeth, it almost curves the other way and it follows the curvature of the lower lip. Now, we call this smile arc, and it's a really important consideration for a good aesthetic smile. So really happy about the aesthetic change that we got here for Rob. But also really excited about the functional change that we got. Again, he's able to bite through things with his front teeth, and all those back teeth share the load of chewing. So a much more functional bite. But if you really want something to smile about, then understand this. Rob was one of our first patients to use our JFO On the Go remote monitoring system. And when I told you that I have a video of a very similar case where a woman wore a night guard that just covered the front teeth, her bite looked very similar, where she only hit on the back and hit nothing in the front. That was pre-JFO On the Go, so that was a couple of years ago. And her case took 18 months. She was in treatment, and it required 10 visits into the office. Rob's treatment, by contrast, now, both of them were great patients, and so we got to give both of them credit for being great patients. But Rob's treatment, by contrast, required only 10 months and only 5 visits into the office. And Rob's a great guy. We certainly wouldn't mind seeing him 10 times, but what a savings for him to have 5 fewer in-office visits and to save 8 months of treatment time using our JFO On the Go system. So I always like to do a little bit of quick math. Hey, let's assume that we save 5 visits. Let's assume that each of those visits is 30 minutes each. Well, now we've saved 2.5 hours of chair time, like time that he's actually in the office. Let's assume that Rob lives 15 minutes away from the office. And so each of those visits again is a 30-minute to and from. So once again, we save another 2.5 hours. That's 5 hours of his time saved because of using our JFO On the Go remote monitoring technology. And then we also saved him 8 months in treatment. So pretty incredible. That's really something to smile about. And we're really happy with our JFO On the Go system and what it's able to do for our patients, reducing their treatment time and giving them time back into their lives to be the busy people that they are. So Rob, thank you for being an awesome patient. We're so glad we have given you this awesome, both functional and aesthetic results. And we love your smile and we want you to go out there and show it off to the world. So thanks so much.